This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Welcome to this episode of Your Health, coming to you from the Health Broadcasting Service HBS radio channel. The segment is packaged for men. It is about men's health. Our topic for today's discussion is prostate health for men. Only men have a prostate. The prostate gland is located just below the bladder and surrounds the top portion of the tube that drains urine from the bladder, also known as the urethra. The prostate's primary function is to produce the fluid that nourishes and transports sperm, that is the seminal fluid. Your prostate produces some of the fluids contained in your semen, the liquid that transports sperm. This liquid contains special enzymes and hormones that help your sperm cells function properly, which means the prostate plays a key part in your fertility. You may have heard that prostate problems are age-related, which leads to the question of what age prostate problems start. The cause of prostate enlargement is unknown, but it is believed to be linked to hormonal changes as a man gets older. The balance of hormones in your body changes as you get older, and this may cause your prostate gland to grow. Is it part of prostate growth, or is it a normal part of aging? What clearly can be said is that around age 50, many men begin to have uncomfortable symptoms because of this enlargement. If you are a man over age 50, chances are that you know, or will soon know, someone taking a medication for an overgrown prostate gland. Better known as benign prostatic hyperplasia, BPH, this condition can cause bothersome problems like frequent urination at night, difficulty completely emptying the bladder, and the urgent need to urinate at inconvenient times. BPH triggers noticeable problems in a third of men in their 60s and nearly half of those in their 80s. Drug therapy relieves symptoms, and for severe problems, surgery may be considered. But for men with milder symptoms that don't interfere much with their daily lives, there's another option: watchful waiting. Therefore, men, you have to take your prostate health seriously. It is good to take note that the two prominent quality of life issues associated with living without a prostate are the loss of urinary control and the loss of erectile function. You will agree that these are key male functions. Know your body, and learn to spot any recent changes. So, what are the first signs of prostate problems? The symptoms of a prostate problem may include problems with urinating and bladder control. This could mean some trouble starting urination or stopping urination once in progress. If you have bacterial prostatitis, your symptoms may come on quickly, or they may come on slowly and last a long time. If you have BPH, you may need to wake up often to urinate when you sleep. Prostatitis is treatable using a combination of painkillers and a type of medicine called an alpha blocker, which can help to relax the muscles of the prostate and bladder neck. It can also sometimes be treated with antibiotics. Talk to your health professional before embarking on any treatment. Most men will recover within a few weeks or months, although some will continue to have symptoms for longer. These symptoms could also often warrant frequent urge to urinate, need to get up many times during the night to urinate, blood in urine or semen, pain or burning urination, painful ejaculation, frequent pain or stiffness in lower back, hips, pelvic or rectal area, or upper thighs, and dribbling of urine. There might be pain and/or a burning sensation when urinating or ejaculating. It is important for men to maintain their prostate health regularly. Check your prostates regularly. How do you check your prostate? As said before, do not ignore any new bodily changes or functions. Visit your doctor for yearly screening, especially if you are over 50 or have a family history of prostate problems or prostate cancer. Prostate screening tests might include a digital rectal exam, otherwise commonly called a DRE. During a DRE, your doctor will insert a gloved, lubricated finger into your rectum to examine your prostate, which is adjacent to the rectum. If your doctor finds any abnormalities in the texture, shape, or size of the gland, you may need further tests. Maintaining good prostate health. Foods and drinks. Aim always for a healthy eating pattern. Some sources claim that drinking tea is advantageous. Both green tea and hibiscus tea are among the top-rated drinks for prostate health amongst men. Both types of tea contain potent antioxidants. Studies show that green tea can help prevent prostate cancer from forming and may also slow the growth of aggressive prostate cancer. Avoid alcohol or drink responsibly. Instead of focusing on specific foods, physicians, dietitians, and researchers tout an overall pattern of healthy eating, and healthy eating is easier than what readily comes to your mind. Experts recommend a healthy diet. Eat at least 5 servings of fruits and vegetables every day. Go for those with deep, bright colors such as carrots, purple cabbage, red, green, and yellow peppers, and such like. Choose whole grain bread instead of white bread, and choose whole grain pasta and cereals. Avoid anything made with white or bleached flour. Certain foods have been touted as possible prostate gland irritants. Foods such as red meat and processed meat. A diet high in meat, particularly if it is cooked well done, may be associated with an increased risk of developing prostate cancer. Dairy. Consuming enormous amounts of dairy products may increase your risk of developing prostate cancer too, according to reports. Alcohol and saturated fats are also to be avoided. Therefore, limit your consumption of red meat, including beef, pork, lamb, and goat, and other processed meats, such as bologna and hot dogs. Fish, skinless poultry, beans, and eggs are healthier sources of protein, therefore aim to incorporate them massively in your nutrition. Choose healthful fats, such as olive oil, nuts such as almonds, walnuts, pecans, and avocados. Limit saturated fats from dairy and other animal products. Avoid partially hydrogenated fats, trans fats, which are in many fast foods and packaged foods. Have preference for or develop a taste for your own home cooking. Some foods have been classified as helpful in the natural prostate health maintenance. Top 5 foods on the list include cruciferous vegetables. This class of vegetables includes things like cabbage, bok choy, kale, cauliflower, and Brussels sprouts. Also included are berries, fish, and cooked tomatoes. Avoid sugar-sweetened drinks, such as hidden sugars in sodas and fruit juices. Only eat sweets as an occasional treat. Do not set too high standards you will find difficult to keep to, but be health conscious. Cut down on salt. Choose foods low in sodium by reading and comparing food labels. Take time to read food labels for useful hints and information when you go shopping. Limit the use of canned, processed, and frozen foods. Consumption of eggs may increase risk of developing a lethal form of prostate cancer among healthy men, some unconfirmed sources also claimed. Whatever it is, watch your food portions. Eat healthily. Little sizes and regular is healthier than big, massive portions in one go. Eating slowly and stopping to eat when you are full is a great advice. Exercise. Next, form a regular habit of cleaning your prostate through healthy diet and regular exercise. Staying active for prostate health is of utmost importance. Additionally, to eating a healthy diet, you should stay active. Regular exercise reduces your risk of developing some deadly problems, such as heart disease, stroke, and certain types of cancer. And although fewer studies have directly assessed the impact of exercise on prostate health, those that have been done have concluded that exercise is beneficial. A study based on questionnaires completed by more than 30,000 men in the Health Professionals Follow-up Study, researchers found an inverse relationship between physical activity and BPH symptoms. Simply put, the study found that men who were more physically active were less likely to suffer from BPH. Even low to moderate intensity physical activity, such as walking regularly at a moderate pace, yielded many benefits. Using data from the Health Professionals Follow-up Study, researchers also examined the relationship between erectile dysfunction and exercise. They found that men who ran for an hour and a half or did 3 hours of rigorous outdoor work per week were 20% less likely to develop erectile dysfunction than those who did not engage in any exercise at all. Adding physical activity to your lifestyle brings great benefits. Interestingly, regardless of the level of exercise, men who were overweight or obese had a greater risk of erectile dysfunction than men with good exercise regime. We will address the issue of erectile dysfunction in another episode, so be on the lookout. Some Italian researchers randomly assigned 231 sedentary men with chronic prostatitis, a chronic infection of the prostate gland, to one of 2 exercise programs for 18 weeks, aerobic exercise, which included brisk walking, or non-aerobic exercise, which included leg lifts, sit-ups, and stretching. Each group exercised 3 times a week. At the end of the trial, men in both groups felt better, but those in the aerobic exercise group experienced significantly less discomfort, anxiety and depression, and improved quality of life. BPH might be life-disrupting, but with the right care and the correct approach to fluids, it is possible for most men to minimize their symptoms and live comfortably with an enlarged prostate. If left untreated, an enlarged prostate can lead to a sudden inability to urinate, cause urinary tract infections, and permanent bladder or kidney damage. Therefore, act today. We will round up this segment with an encouragement to men to look after their prostate health. If you are over 50 and have never attended for a prostate health screening, you need to contact your doctor and arrange an appointment today. We will bring you more information from time to time. This program has been brought to you by the Health Broadcasting Service HBS Radio Channel, UK. Remember to stay abreast of our future broadcasts by subscribing to our channel to receive future helpful and beneficial episodes. We will be back again soon. And until then, it's bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.